Hello and welcome back to our channel SWAS Care. Today, we will see an insightful QA session that will be incredibly helpful for anyone preparing for a care worker or care assistant interview in the UK. We'll cover essential areas such as your role of a care worker, personal development, safeguarding, and much more. With us today is Samir, an experienced care worker who is giving his interview to Mark, who is the HR manager of a large care home in UK. Let's get started. Mark, before we dive into the specific questions, please introduce yourself and tell me a little bit about your education and your past experience as care worker.
Samir, absolutely. My name is Samir. I completed my diploma in health and social care a few years ago. I have been working as a care worker for the past 3 years. During this time, I've supported elderly clients with daily activities, personal care, and emotional support. My experience also includes working with individuals who have dementia and learning disabilities, where I've applied person-centered care practices to meet their unique needs. I'm passionate about providing compassionate and respectful care to those who need it. My first experience with caring for someone was with my grandfather, who was critically ill, and I had to care for him for 3 months. This experience exposed me to the happiness we get in caring for someone.
Mark, how do you ensure that you continue to develop professionally in your role?
Samir, I believe continuous development is crucial in care work. I regularly attend training sessions, such as those on safeguarding and first aid. For instance, last year, I completed a course on dementia care, which has greatly improved my ability to support individuals with this condition. I also seek feedback from my colleagues and supervisors to identify areas for improvement.
Mark, what does the duty of care mean to you, and how do you apply it in your work?
Samir, duty of care means always acting in the best interest of the people I support. For example, if I notice a resident has developed a sore, I immediately report it and ensure they receive the necessary treatment. It's about being vigilant and proactive in preventing harm.
Mark, how do you promote equality and diversity in your care work?
Samir, promoting equality and diversity is about respecting each individual's unique background and needs. For instance, I once supported a client who followed a strict vegetarian diet due to their religious beliefs. I made sure their meals aligned with these preferences while ensuring they were still receiving balanced nutrition.
Mark, can you give an example of how you work in a person-centered way?
Samir, absolutely.
Working in a person-centered way means putting the individual at the heart of everything. For instance, I had a client who loved gardening. So, we incorporated gardening into his daily routine, which not only made him happy but also helped in his physical and mental well-being.
Mark, how do you ensure effective communication with clients who have difficulty expressing themselves?
Samir, effective communication is key. I use simple language, visual aids, and body language to support those who have difficulty. For example, I once cared for someone with limited speech due to a stroke. I would use picture cards to help them express their needs, ensuring they felt heard and respected.
Mark, how do you maintain the privacy and dignity of those you care for?
Samir, privacy and dignity are fundamental. I always ensure doors are closed during personal care and cover the person as much as possible. For instance, when helping someone with a bath, I make sure to only uncover the area being washed at that moment, keeping the rest of their body covered to maintain their dignity.
Mark, how do you ensure that those in your care receive adequate fluids and nutrition?
Samir, I monitor their intake closely, ensuring they have enough to drink and eat throughout the day as per the target of fluid intake set for them in their care plan. For instance, I once supported an elderly lady who was at risk of dehydration. I made a habit of offering her drinks regularly and recorded her intake to ensure she stayed hydrated.
Mark, how do you support individuals with mental health issues, dementia, or learning disabilities?
Samir, understanding their specific needs is essential. I once cared for someone with dementia who was often disoriented. I used familiar objects and routines to help reduce their anxiety. And I always approached them calmly and patiently to build trust.
Can you share an example of how you've handled a safeguarding issue?
Samir, safeguarding is a top priority. There was a time when I noticed unexplained bruises on a client. I reported it immediately to my manager, who then initiated the safeguarding procedure. It's crucial to act quickly and follow protocols to protect vulnerable individuals. Mark: okay, tell me, how would you handle a situation where you suspect a child is being abused? Samir: I would follow the safeguarding procedures without delay. Although I primarily work with adults, I understand that any signs of abuse in children must be reported to the designated safeguarding lead or to the local authorities. It's about ensuring the child's safety above all. Mark: can you explain how legislation in the UK supports safeguarding practices, and how do you apply this in your role as a care worker? Samir: UK legislation, like the Care Act 2014 and the Safeguarding Vulnerable Groups Act 2006, provides a legal framework to protect vulnerable adults and children from harm. These laws ensure that care workers follow strict procedures to identify and report any signs of abuse or neglect. In my role, I make sure to stay informed about these laws and always follow the correct safeguarding procedures. For example, I report any concerns immediately to my supervisor and ensure that my actions are in line with the legal requirements to protect those in my care. Mark: can you talk about a time when you had to use your basic life support training? Samir: thankfully, I haven't had to use it often, but there was one instance where a client collapsed. I quickly assessed the situation and performed CPR while waiting for emergency services. My training helped me stay calm and act effectively in a critical situation. Mark: how do you ensure health and safety standards are met in your work? Samir: I always conduct risk assessments and follow safety protocols. For example, I once identified a tripping hazard in a client's home and arranged for it to be removed immediately. It's about being aware of potential risks and taking steps to prevent accidents. Mark: how do you ensure that personal information about those you care for is handled appropriately? Samir: I adhere to confidentiality policies and only share information with authorized personnel. For instance, I always store client records securely and never discuss personal details outside of work. This ensures their privacy is protected at all times. Mark: how do you apply infection prevention and control measures in your daily work? Samir: I follow strict hygiene practices, such as hand washing, wearing PPE, and sanitizing equipment. During the COVID-19 pandemic, for example, I was extra vigilant, ensuring that all surfaces were disinfected regularly and that I followed all guidelines to prevent the spread of the virus. Mark: okay, Samir, tell me, how does the Care Act 2014 influence your work? Samir: the Care Act 2014 is crucial as it outlines my responsibilities to provide high-quality care that respects individuals' rights and dignity. It guides me in ensuring that care is person-centered and that I am always working in the best interest of those I support. For example, it helps me focus on promoting independence and well-being for each individual I care for. In the end, before we wrap up, here are a few tips for those of you preparing for care worker interviews in the UK. Make sure you're familiar with important laws like the Care Act 2014 and safeguarding regulations. Knowing how these apply to your role shows that you're informed and ready to protect those in your care. Use real-life examples. During the interview, try to share specific examples from your past experience. This helps demonstrate your practical knowledge and how you've applied your skills in real situations. Highlight your commitment to person-centered care. Explain how you tailor your support to meet the individual needs and preferences of those you care for. Finally, stay calm and be yourself. Interviews can be nerve-wracking, but remember, the interviews want to see who you are and how passionate you are about the role. Remember to stay confident in your abilities. I'm sure this video would be helpful as candidates prepare for their interviews. If you have any questions or would like more tips, drop them in the comments below. Don't forget to like, share, and subscribe for more content like this. Until next time, take care.